TV, Cool TV, and guess what? We are the coolest station in the world. And I am your host, Napanji Thomas, better known as Dr. T. And I have my other host here with us,
Dr. Fishta.
and we have a guest in the building, everyone. So we have Michelle Clear in the building with us, and we're going to be talking about bipolar disorder. So let's give a little definition of what bipolar disorder is. So we know that it is known for its manic episodes as well as depression episodes, and it really has causes people to have problems with their mood, right? So what else can you, well actually before we do that, Michelle, tell us a little bit about yourself.
Well, I'm a licensed professional counselor. I own my own private practice in Grand Rapids, Michigan. And I love working with bipolar people. I have a lot of experience with it, personally as well as professionally. So I kind of know this disorder inside and out. It is very personal and very important to me that it gets the reputation that it deserves. It's a tough disorder to treat because it's got a lot of things going on. It's got anxiety, it's got that mood disorder, it's got that sleep disturbance, personality problems. There's a lot involved in diagnosing bipolar disorder. But it's also one of the coolest things to work with because of the variety that a human being feels with it. So it's not limiting, and I like that.
Yeah, and you're right, Michelle, and the reason why Dr. T and I wanted you here today is, I remember you and I went to school together.
Right.
10 years ahead of us, right?
We did.
And from very early on, you showed interest, and you studied bipolar in depth back in the day, and you've been working with from time to time since, from a professional point of view. And we know it's stigmatized. A lot of people stigmatize bipolar. A lot of people don't understand it. There is the phenomenon with children that a lot of people don't understand, and with the elderly, and we have different kinds of bipolars and so forth. But go ahead.
Yeah, it's thought that bipolar disorder is linked to genetics, environmental factors, and altered brain structure.
I believe that.
Okay, so tell us a little bit more about that. When we're talking about, because really nobody knows where bipolar disorder came from.
It's just the oldest disorder that's been examined. It's the oldest that they have any research on. But it was called manic depressive before, so they changed it to bipolar, I think, in the 70s. But it's basically been the longest standing mental illness out there, and why it's been around for so long is because of the severity of when it was first diagnosed. No one really understood the mania part of it. No one understands that really psychotic emotional piece that goes to a true bipolar diagnosis, because remember, there's 3 diagnoses in bipolar. There's bipolar 1, there's bipolar 2, and then there's bipolar 3, which is, I can never pronounce it.
Cyclopamine.
Right. Yes.
Right.
And then it's also, it can be, I was reading just the other day, there was an article that said that it can also be triggered by drug addiction
That is
or
true.
by medication.
Correct.
So,
Yeah, which is really the fourth that they
Exactly, that fourth
due to
type.
other
Yep.
medical conditions or
Exactly.
substances. Correct. Yeah.
Exactly.
Yeah.
Yep. So what makes it genetic, though, is that you will find it in families, and that's what's interesting about it when it's in a long family line, is that it starts to show up in children at younger and younger ages. I personally have a son that was diagnosed at 5, and I have a daughter that was diagnosed at age 20.
And that's kind of the change for bipolar disorder, because there was a time where you wouldn't get diagnosed with that until you were either late adolescence or in your early 20s.
Correct.
But now research is finding that these signs and symptoms are seen in children even as young as 3 years old.
Correct. I saw signs in my son at a very young age, and it really showed itself in the depression end. It shows itself more in that really moodiness and not being able to get talked out of a mood, and really the symptoms there are very strong in children. When it shows up in children, it shows up more textbook. It's really defined easily in kids. What makes it hard though is that it coincides with attention deficits. So you've got a lot of kids that might be hyperactive because they have that. But then there's that component of bipolar that's not the same, and it's really it's interesting to diagnose it because there's a lot you have to look at.
Which diagnosing is just vitally important because we're talking about treating or often psychiatrists and medical staff make recommendations for medications, right? And
Right.
there's different medications that are used for bipolar. You have the mood stabilizers, and then when we're talking about ADHD, you have the stimulants, right? Which
Right.
are
But you cannot give a bipolar person a stimulant.
that's correct because
Well, tell us why. Tell us why. Why should we give a person a stimulant if they have bipolar disorder?
Because that will send that poor person into a manic state of thinking.
it stimulates the
Yeah,
mania,
yeah,
right?
it
It
stimulates
stimulates the
it.
central nervous system.
So when we're talking about mania, let's go into a little more detail about what that looks like, because most people know what depression looks like.
Right.
The sadness, the crying for no reason, the inability to get out of the bed, loss of interest. So those are the lows, what we call those clinical lows. And we know that with bipolar disorder, there's that up and down, the peaks and valleys that an individual will experience. So tell us more about the mania part of it.
Well, most people, like you said, will go to the hospital or go to the doctors when they are depressed. What happens is we kind of overlook the mania. And here's the reason why. Because no one's going to go in and admit that their sex drive is higher than normal. No one's going to go in and admit that they're spending too much money or that they have addictions or that they can't sleep and that they're awake for 4 weeks at a time. I mean, the mania part is so hard to diagnose because everyone kind of feels like they're managing it. They like the mania. I'm in a good mood. I feel good. I have energy. I'm cleaning the house at 3 o'clock in the morning. Nobody's up. It's like perfect.
But this is the perfect time anyway to be cleaning the house because everyone's sleeping. I don't have, and
Exactly.
people with depressed speech.
Right.
Just like I
Yep.
was talking very
Yep.
rapidly, those are some of the signs
Yes.
as well to look for, right?
Right. So a lot of people don't admit to their doctors that they've had this extreme high. They usually just come in and talk about, I'm so depressed, I don't like how I'm feeling. So it can, sometimes you can be put on an antidepressant and it sends that person into a really big mania because they didn't describe that part to the doctor.
Which is so important, the
Right.
diagnostic part of it, right?
Right.
Because that's correct, the antidepressants, they want to bring you out of the sadness, and in the process of bringing a person out, you could throw them off. Now, when we talk about the mania, the phase of mania, obviously we have the rapid moods, and we have the longer mood switches, and once a person goes in a higher mood, we're talking about hypomania, which is a lighter form of mania.
Right.
Mania is a little easier to catch, right? Especially extreme episodes of mania, because a person could experience some form of psychosis, so to speak.
Right,
And
you can have-
family, friends, and others will quickly pick up on that. But it's this hypomania that becomes very difficult in diagnosing and what you're referring
Right.
to. as,
Because a lot of people aren't going to admit that they're out shopping or that they're not. I mean, I think we hide a lot of stuff. And what's interesting about bipolar is that it's easy to hide. Like, that's part of your personality. That becomes part of your personality. That fun person, the one that wants to go out shopping, the one that wants to stay out late at night and drink, the one that wants to, let's go plan this event or let's go do this hobby. And they're more active. And so that's the kind of the fun friend. Everyone wants to hang out with the bipolar person when they're maniac because they're fun to be around.
That's correct.
And now there's also, excuse me, I know I've had clients with bipolar disorder, and for the clients that I usually see, there's also some volatile behaviors
Oh, yes.
that go along with that. Can we talk about some of those volatile behaviors and maybe why that possibly happens?
Well, I think what happens is when you get to that point in your mania, you are no longer attached to reality. Okay, so you're starting to think in these negative forms of thinking. And what I've witnessed with rages and with that high level of irritability, that's what it is. It's just there's simply no way to communicate how they're feeling, so that's when you start to get the violent acts. But, you know, it's really unfortunate to look at bipolar as a disorder of anger. It does have one component of that. So you can have bipolar without the anger.
Exactly.
And I think that's really important because a lot of times people blame people that have committed crimes and, you know, oh, they have bipolar. Well, maybe they don't. Maybe they don't.
Exactly.
Maybe they don't. Maybe they're just in a really bad mood and someone hurt them and they're hurting that person back. I mean, we have to be very careful with diagnosing because of that anger piece. Rage is part of it, but it's also a very small part, luckily.
Which rage and anger can also stem from depression.
Correct.
Can
Yep.
also be a byproduct of anxiety as well.
Yes.
So
Or
if you
just
look-
stress.
Or
Just
stress.
everyday stress.
Right.
So it gets really, really blurry, right? Now, also we know that this disorder affects relationships in a major way. Right?
Yes.
Yes, it does.
And what can you tell people about signs and symptoms? How can they identify it? How can they talk to a loved ones and so forth? What are some thoughts there?
Well, what's interesting about bipolar is when you've been with someone who is true, I think, textbook, you start to recognize that there are patterns of behavior. And one of those patterns is sleep. Sleep is going to start to get disturbed. And when someone can go from longer and longer periods of sleeping, you're going to start to see that person have more agitation. They're going to start to care less. Their appearance, they're not going to take showers. So there's simple signs that start showing up pretty quick if you're paying attention. The
Now, what if
prob-
the person is alone?
well, that's easy to hide because how easy is it now, especially and we're so isolated right now, to hide from people and pretend that everything's okay. That's a fine line.
Right, I have to agree.
Yeah.
I would definitely have to agree
Yeah.
with that.
So,
Now,
I was just going to say, for relationships, though, if you've been with someone with bipolar, you know there's triggers. You know there's triggers with caffeine. You know there's triggers with stress. You know that there's triggers with work and family dynamics and history. So I think it's just a matter of really knowing that person and what their triggers are. That helps you.
Okay. So if you're in a relationship with someone that has bipolar disorder and you're in an argument, should the other person be more submissive and just kind of let it go? Or is it okay for them to express their feelings?
It's always okay to express your feelings. I'm sorry, I'm like a real advocate. I think I am. That is my favorite thing to say. You have to be able to communicate your standard. We can't let people with anybody's mental illness have any power or control over anyone else. It doesn't give them an excuse to behave poorly. And I've always taught that as well.
Often people report that I feel like I'm walking in eggshells,
Shells.
right? Because, you know, I don't know when he or she is going to go off on me, so to
Right.
speak, which makes that communication
Hard.
very difficult. And people sometimes are scared to tell them what they think or how they feel,
Right.
given that may be in the midst of an episode.
And that's why I think it's so important when I do have bipolar couples that they come in together. It's okay to have your significant other in therapy with you so that they can understand what some of your triggers are. That's been very helpful for me to have that, have clients come in together.
Now, do you think that bipolar disorder is something, and I'm going to tell a real quick story. I was doing an internship, and me and my supervisor had a debate of whether bipolar disorder is curable or treatable. Can you tell us if it's curable or treatable?
I would say it is not curable because it is a mental illness that affects the chemistry of the brain. It is treatable, and you don't have to take medicine to treat it, which is pretty awesome. What it takes, though, is to understand yourself. You've got to understand your triggers. You've got to understand when you're not sleeping. You've got to understand that your diet is huge. Exercise, your support system. With any mental illness on this planet, we have the ability to fix it. We don't have the ability to really cure it. Unfortunately, I don't think so. Not yet, anyways.
And by fix it, I assume you mean to live at
At your
acceptable
maximum.
levels
Yeah.
of functionality,
Correct.
right? And
Yep.
that also leads to
Yep.
to my topic related to employment.
Sure.
Right. Well, before we get into that, it is 15 past the hour, and you all are watching In Session on WJZZ Cool TV, the coolest station in the world. And I am part one of your host, Dr. T.
And I am part two, Dr. Fishta.
And we have in the studio with us Michelle Claire, and we are discussing bipolar disorder and destroying those myths.
And the reason we have decided to have Michelle Clear here, as she shared with you, she has personal experience from different points of view, and also she actually sees clients with bipolar disorder in her clinic out in Grand Rapids.
That is correct. Clear counseling.
Correct, Clear Counseling in Grand Rapids. And Michelle, we're talking about employment, and we know that mental illness, not too far out from now, is going to be number one leading disability worldwide.
This is true.
And bipolar is one of those significant disorders that can really affect a person functioning. What can you tell us about as far as employment?
Well, what I think what really happens with our clientele that have bipolar disorder is that they're not honest and upfront with their employers. You have to really honor that you're going to have days that you're not going to get out of bed. And you have to have kind of this honesty about there's times when you can't focus and your brain is just so foggy that you don't have the ability to work. What I think we're finding is most people that have bipolar can work, but they do better when they're part-time or if they have a job that's very flexible. And I think it's important in today's society to have that option. And I really like now with, unfortunately, this has been a positive for COVID, people have the ability to work from home. And maybe some flexibility is what a bipolar client needs.
That makes sense because perhaps it gives them a sense of control, the
Correct.
ability to take time out
Yep.
and kind of recuperate
Right.
and work on the issues that.
And there's times when there's psychosis where you have this mental voice in your head that's telling you to do things that aren't of reality. So you do kind of need a break from work. I mean, this is a fine line, and I feel for companies that have to hire someone who's bipolar because not every person that has bipolar is going to be severe. And that's just it. And you don't know when you're going to have an episode. You really don't know. They fluctuate. They change. That's what makes it such a difficult disorder.
Right. Now, with saying it's a difficult disorder, is there ever a period of time when a person feels normal, or what we perceive as normal?
Yes, for sure. What makes bipolar is that there are periods of mania, there are periods of hypomania, there's periods of depression, and then there's periods of stability. And stability is what is the foundation that we build on. That's hopefully we find our partners when we're stable. Hopefully we find our employment when we're stable. Because then when we go into those manic moments or when we have those episodes, that person realizes, oh, this is a bipolar moment you're having right now. This is not you just being a jerk. This is, oh, wow, look at, you're really going through something right now. I think it's a matter of really communication and being able to say, I feel this right now, or this is coming up right now, or I'm really stressed out. Stress has a huge impact on bipolar, and this is a stressful time for a lot of people right now.
So what I'm hearing from you is that bipolar disorder is a condition that affects one's mood as well as their cognitive ability, but they can still function.
Yes.
But they're just going to have some bad days, and to be mindful of those days.
Correct.
And to maybe engage in some type of counseling or therapeutic services, or
They have to have a lot of support, and it's not just going to be a therapist. It's going to be a supportive family. It's going to be a good friend. It's going to be, could be even a coworker. It's just someone who realizes, hey, you're going through something right now. I want to be there for you.
so what does that look like for someone as a friend or family member, someone that has bipolar disorder? How can that individual support that loved one?
Well, as a mom of two children with it, it's not an easy thing to be supportive, because what happens is when my son would have a manic moment and he would have a rage, or he would have something, a little tornado we used to call him, he would recover, and I would be like, the sky fell. I mean, it would just be awful, and it would take me so long to just feel like I was human again, and that I was okay, and that I was going to breathe. Meanwhile, he was on to the next thing. So I think learning to be patient and learning to just love the process of it. I used to realize, and I'd have to be really kind with myself, that it's not my fault. And I think that's really important when you have a child with bipolar disorder, to not blame yourself or feel like you're a failure, because we have no control over what's happening in someone else's brain.
So while you're talking about that, Michelle, given your personal and professional experience, what can parents look out for? How would they know that perhaps they need to take the child to a professional? What are signs and symptoms that could show up early?
Well, definitely the sleep disturbance is definitely one of them. Also personality. I was really surprised. My son never smiled for years, which is a really weird thing to see a kid not smile. There's no laughing. There's no sense of enjoyment. There's no... that's a hard thing to witness in a kid. And sometimes I think we overlook it because we expect kids to be quiet, which is really weird. I don't know why we do that. But, so you can look for that symptom. I know a lot of times it gets picked up very easily in school because of the attention piece. They really struggle with paying attention or following rules or staying within the kind of boundaries of what's expected.
So when it comes to school, can it be misconstrued or confused with another type of diagnosis because it has such similar symptoms?
Yes, and what I discovered with my own child is that I could not go to the school with the bipolar disorder. They had to test him themselves. So they got their social workers involved, and they got their team of experts involved, and they had to diagnose, because they didn't want to just take my diagnosis that I had from the doctor. They wanted to make sure that that was accurate as well, and that allowed my son to get special classes, get a 501, go on and have accommodations the rest of his school year. So it's really important.
What's that test? What is that called when they do the testing? It's
Sorry.
what's it called?
504, what is that? What do you...
No, I know in the school when they're doing the testing, they usually have like the IEP,
Right,
or the independent
right.
development plan,
Right.
but they do a specific type of testing, and I'm trying to think
Starts
of
with the
the name.
W. Oh, is it the Walsh? Or,
Testing for bipolar?
Well, when they do testing in the schools, they test for everything.
Right.
They test for learning disability. They test for mental health disabilities.
IQ.
IQ. So they're doing a combination of tests, and I can't remember what it's called because I used to go to them when I did foster care work. I can't think of the name of it. If anybody in the listening audience knows what the name of this is, I know I have teacher friends out here. Please call us at 313-355-6018. The phone lines are open now, so call in. Again, the number is 313-355-6018. And if you know the name of this test, give me a call because I can't. I'm not remembering right now because it's been years since I've done that.
right.
But there's special accommodations
Oh, yeah.
that they do for these children in the school setting where they have this individual treatment plan so the teacher can work with them, and then they'll have other resources where they may be even removed from the classroom to learn how to manage their behavior. So have you noticed, like with your son, and even with your daughter's a little bit older now, right?
She was just diagnosed, which is very unusual for us. I really never thought she would have bipolar, but when you look back at her childhood, she always had anxiety, so it might have been there, but we were so wrapped up in my son's disorder and where he was needing,
That she kind of got it.
she kind of got it neglected. So, and I think that happens a lot, unfortunately, with children with anxiety, too. We tend to think that everybody has anxiety without looking at maybe there's something behind it.
Yeah, and I wanted to go back to that sleep, which you mentioned is one of the possible early signs or symptoms, and it can be very difficult, right?
Correct.
Because kids will stay up late, and especially right now during these times, the schedules at times are different, right?
Right.
What does it look? What is abnormal sleep, so to speak? That can be something that could be more than just simply I'm on my phone.
Well, here's the difference, and my son is like this now. He can stay up between 16 to 24 hours at a time without any indication that he's
So
tired.
you're talking about pulling all night or something?
Oh, but like 2 or 3 days in a row, he can put an
There
all-nighter.
you go.
Yeah.
And then,
some people can even go like a week or two.
right,
Or
oh
even
yeah,
longer.
you can go,
with no sleep.
with no sleep. And what happens when you are sleep deprived, it changes everything in functioning of the brain. So when a kid can go more than 2 days without sleep and not being cranky and not being tired and actually having like the same level of energy 24 hours, that's a sign. Because that's not normal.
So, Michelle, to be clear, to the parents whose kids are staying up until 1 or 2 and they don't want to get out of bed the next day.
That's normal.
Okay, thank
That's
you.
normal. You can stay. You can have an all-nighter and then get up and go to school the next day. That's not a problem. What the problem is with bipolar is that they will stay up and be perfectly fine, and you're
Like they had 8
like
hours
they
of sleep.
but they just were doing their own thing.
So basically, that's pretty much the definition of insomnia,
Right. Right.
Correct.
Yes. Yep. Yeah.
which is one of the main symptoms of bipolar disorder.
That is correct.
Also, a bit on those grandiose thoughts, where there's a inflated self-esteem and so forth. And that can vary. And teenagers often they have their imaginary world that they engage to. At what point can a person know that, oh, this is more than my child being creative, so to speak, and having some expressive thoughts?
That's a good question.
That's a very good question, and I don't know how to answer it.
And I believe that this comes with a sense of grandiose thoughts where the person is on top of the world, can do it all, be it all. And I think another factor there is when they're pushed back or when
Right.
they're asked to get back to some sense of reality.
They can't return to
They
it.
can't return. That's where
Right.
anger can come in and
Right.
you don't want me to be who I really am and
Right.
I'm so good and you interfere with my
Right.
God-given gift, so to speak.
Right.
Oh my goodness, that happens a lot with adolescents. Oh my goodness.
So see how difficult it is to say bipolar? It's really hard to nail it. I mean, it really is.
So, and also last week we talked about anxiety, right? Which
Right.
anxiety could be a byproduct of bipolar because you have the extreme mood swings, and the person knows they're depressed, their emotions are out of control. They know they're in a hypomanic or manic episode, and this discrepancy between these emotions can make a person anxious because things are unpredictable. I can mess up my relationships. I can get in trouble. I get angry. I have no control over. Have you seen any of that anxiety as a byproduct of folks with bipolar?
Yes, for sure. And what happens is, if it's the same thing with depression. If it goes undiagnosed, it can become worse because that you're not learning how to cope with it. You're not learning how to handle it. So it's just creating more and more negative thoughts about yourself. I'm not good enough. I don't fit in. Nobody likes me. Then you start to have these paranoid thoughts. And there's a lot that goes involved in that anxiety piece. But with children, anxiety can be different things. It can be not wanting to be with their friends. It could be fighting back. It could be just a plain irritable emotion. there's a lot involved in knowing whether or not your child is suffering from anxiety or if they're having a real bipolar moment.
And studies also show, and this is where it really gets blurry and difficult for parents and even clinicians to identify, diagnose, and treat, right?
Right.
Because now we know that a large number of children who have ADHD, their studies are showing later in life could experience actually bipolar disorder.
That is true.
And a person could have both, right? You
Yes.
can have,
Yes.
you can diagnose ADHD, you can diagnose bipolar. It really gets blurry and difficult for people to treat and move forward. Any thoughts in these areas, Michelle?
Well, I think again, what's so tricky is you got to be careful with medications because we're not going to give a bipolar child any kind of stimulant. You're going to find out real fast if they have bipolar. What will happen is it will send them into, well, actually my doctor described it, it'll send them into two directions. One, they will be so high you won't be able to get them off the ceiling, or they'll be so low you won't be able to peel them off the floor. So you're going to have an extreme reaction if you give a child a stimulant.
So it can
is
even affect the mood in
Oh,
most ways.
yes, very much so. And when you can't even explain it, like I think that's the hardest part for a child too, is here we are adults and we're struggling with the words for it. How does a kid say, hey, I don't feel right?
Right.
You know, it's hard to get that language.
Right. Well, we are half past the hour, and you are watching or listening to In Session on WJZZ, the coolest radio station in the world. And you are with Dr. T and
Dr. Fishta?
our very special guest, Michelle Clear.
Thank you.
And we are discussing bipolar disorder. So elaborate a little more about what you were just talking about, if you can.
With the children and what happens when they're diagnosed with attention deficit, what happens if you're given a stimulant is they're going to have severe reaction. So you're going to find out pretty quickly whether or not it's a bipolar attention problem or if it strictly is a attention problem. If a child has attention deficit and they're given they're given a stimulant, they're going to pay attention. It's not going to cause sleep disturbance. It's not going to give them those other symptoms. If they are bipolar with attention deficit, it's going to bring out the bipolar reactions. And so I think that's the difference. People are so afraid to put medicine on their children or to give medicine, that attention medicine, but really when anything that you can help your kid calm down, focus, and pay attention, how is that a bad thing?
So would it be fair then to say that one of the things that folks can, people can look out for is that if a child has difficulty with focus and attention, and the teachers sometimes can be quick to say that your child isn't paying attention, right? There's some attentional issues where there could actually be depression, and there could be a phase of hypomania or mania, or the child is just moving around, not sitting and doing things that they're not supposed to in class, and often it can mirror ADHD, and
Right.
we want to fix the problem. The parent wants to fix the problem, the teacher wants to fix the problem, and here we run treating ADHD. The diagnosis seems to be one of the very, very important elements of
It's very important, and most teachers are really, there's a lot of testing out there too. There's a lot of things that when you get a client, even for me, I have a whole bunch of questionnaires. There's a lot that goes into looking even for just the definition of attention deficit, because it's not just lack of concentration, it's also foggy thinking. There's irritability that goes with it sometimes. There's also that lack of just not being able to make decisions, not even be able to pick out what clothes to wear in the morning. There's a lot of things that can go into it.
Now, going back to bipolar disorder, as a clinician, what are the steps that you take when you get that phone call and somebody says, "Hi, I'm Pangie, and I'm calling because I'm feeling depressed. I just had a manic episode," or I think there's something. They may not use the right terminology.
Right.
They may say that I had a lot of energy and now I feel really sad and I need to see someone. How do you walk us through that process of that initial contact and then getting them into treatment?
Well, I'm so grateful they called. That's the first step.
But that's the hardest part,
That's
right?
the hardest part.
What
Thank
did
you,
what
thank
did
you,
Beth
thank
used
you.
to say to us? Okay. So disclosure: we all went to the University of Phoenix and had an instructor by the name of Beth Combs. God bless her soul. She's passed away now, but she always used to tell us the hardest part for a person with a mental health disorder or a problem is to pick up that phone because it feels like 1,000 pounds. So thanking them and encouraging and being motivating them that they called is the first step.
Yep, so I usually thank them for calling, and I usually ask them what kind of availability they're looking for, because I want to get them in right away. Usually if someone's depressed, you want to see them pretty quickly. Anxiety, I can let that sit for a little bit. I'm not as worried, but when someone says that they're depressed, I want to see them right away. And sometimes I'll see my depressed clients maybe twice a week too, just because you want to kind of get a better eye on them. But what I really do is I talk to them and just basically get the basics, like, okay, you're not feeling well, when do you want to come in? And then when they're in, it's, unfortunately you have to do that kind of piece that's just business. Give me your name, your address, the insurance, all this good stuff, and then tell me what's going on. And I think that's, it's building that relationship and just thanking them for having the braveness to call and reach for the appointment.
So when you're doing that assessment, what are some of the key words or behaviors that you're looking for?
Well, they're going to say that they're sad. They're going to say that they're struggling with relationships. You always look at the 5 things. I always look at what's your relationships like, what's your stability, are you able to keep a job, are you working right now, did you just take FMLA because you need to be home? I mean, I always ask that question about being home. I always question about support systems, who's in the home with you. I always ask about, do you have a safety plan? We kind of want to make sure that someone who's severely depressed has someone that they can talk to, because I'm not available 24/7. So there's a lot of things that I'll go into, but you really look for someone who recognizes in themselves that they're just not themselves. They don't really know what's wrong. They know something's wrong. And so it's kind of communication of, well, do you feel like this? I'll ask questions. Do you feel like that? On a normal day, what does a normal day look like? What did it feel like 6 months ago? Because a lot of times you'll find people will have suffered for a long time before they come into therapy, and all of a sudden they make the phone call and they feel good. Have you ever experienced that?
Problem fixed.
Exactly. I saw you one time. I feel good. I'm good. Thanks. I'm going home.
But that's the thing. With bipolar disorder, we know that it has to persist for at least 2 weeks or longer. And for some people, they may not even know that they have bipolar disorder.
Correct.
They just know that something's wrong, and they're coming in to find out what the heck is going on with me.
Well, they're going to come in usually when they're depressed. They're not going to call me when they're high. They're having a little too much fun then. And that's a fun part of asking people that come in when they're depressed. I'm like, well, what do you do for fun? Well, I haven't had fun. Well, come on. And then I try to pull it out of them, because you'll find out that they just spent, $1,000 at the casino, or you'll find out that there is this piece of mania. You will not find bipolar just depression. You won't, and then you can't diagnose that as bipolar then.
And as we're talking about, that first call is important because the person is admitting there is a problem. And
they don't feel good.
By that point, they feel defeated, and then we have the stigma, right? That goes along with that, and also the difficulties that go along with telling someone that you have mood swings that are significant, clinically significant. What's that called? Bipolar, right?
Right.
So it's a difficult process for people to go through.
My favorite saying is that we are all bipolar. We live on a bipolar planet. We have morning, day, sun, gray skies. We live in a bipolar planet. And I try to make people enjoy the fact that they have bipolar disorder. I'm probably one of the weirdest therapists in that way, because I get excited. I'm like, how lucky
That's
for
why
you.
you're a therapist.
I know! Exactly. But I get so excited when someone is bipolar, because you get the whole box of crayons to color with. You get every emotion. You get every thought. Why is that such a bad thing? And I like that I have the ability to kind of instill that hope. Like there's such this bad feeling when they get that. I get so many people that get pissed when I say they're bipolar. I'm like, wait a minute, I'm not saying anything bad. You are interpreting that as bad. Let's look at this in a positive, because you are we now know you have a brain that thinks differently. You have to celebrate
differently,
and
just
functions
overall.
different. And so let's celebrate it. Let's make it a big deal. Let's make it work for you so that you're not losing all your money during a mania moment, and then I can get you off the couch when you're severely depressed.
Now, what about those individuals that go through that rapid cycling where literally 1 minute they're happy and then maybe 2 minutes later they are in a total slump, and then the next minute they're happy again?
That's a very severe bipolar 1 person, and that's going to be called a rapid cycler. And that's going to need a mood stabilizer. That's not going to need an antidepressant. That's going to need something that's really going to get in there and stabilize it.
Studies show over and over, right, for the severe disorders like bipolar that you're describing, Michelle, medications and therapy work
Together.
best, right?
Right.
You have
So can you do one without the other?
Well, it depends on the degree, and correct me if I'm wrong, the degree of the difficulties that disorder brings about.
I agree.
When you talk about these extreme states of mood swings, it could be very risky. Their life could be at risk and all this. When you're talking about full-blown manic episodes, right? If you're talking deep depression, now we're going into an area of possible suicide, right?
Exactly. I'm glad you brought that up.
Correct. So then, with what mood stabilizers tend to do is stabilize that mood, which still is a bridge to something, because you still want to know your strengths and weaknesses, as you were referring to. You want to know when you're most productive, and how do you make the best of that time. And like Dr. T mentioned, and you, Michelle, that is time where you build relationships, where you function at work.
You hope that that's when they get started, during that stable time.
Right.
That's what we're praying for.
And thank you for bringing that up. I was thinking a couple times as you were talking, because if you do enter a relationship when you're significantly depressed, then that can bring some dynamics that may not be sustainable or healthy long term.
Correct.
Right?
Especially when we don't talk much about the bipolar part, but there is a hypersexuality that comes with bipolar. And hypersexuality is going to be that person that is either going to be addicted to porn or several partners, and that's high risk behavior. And we don't talk about sex like it's, sometimes it's supposed to be good, but there's times when it can be very dangerous.
Right, especially when you're having sex with strangers, or you're out and you just see someone and you go have sex in the alley.
Yep.
So
It's often a byproduct of mania, and that's where the risky behavior
because
comes
you've
in.
lost touch of reality, and that feels so good. You want to stay in that high.
in that pleasure mode.
Right. And that's how our brain works. We're
and
pleasure
think
designed.
about what we're saying here. A person is hyper-sexually active, and we're telling them, no, be less sexual,
Right.
just tone it down. It's difficult, right? Because
Way to judge. Way to judge.
in their mind, a person is having fun times,
Exactly.
right? And they're trying to maintain that because they know it could go bad, low, and depressed. So I'm just going to keep this going as long as I can. So how am I going to go and ask someone to bring me down, help me come down off of this state? So it's very, very difficult for people.
Very difficult. And that's probably one of the hardest areas to get into with the client. When I hit that note, I know that client trusts me. When I finally get into that conversation about that piece, I know that client absolutely trusts me, because they're willing to share a part that there may be a slight shame.
So, and obviously, as therapists, we all are, right?
I'm a counselor.
I'm
a counselor, not a therapist.
The relationship is really the most important piece of therapy.
What this is all about.
And so now, once that builds, sounds like you can actually grab from this mania and start to identify it, look at it, and know that it could be a hindrance versus some form of happy world. So to speak.
Correct.
Okay.
Because So that takes trust, and that's why it's so important for just, like you said, just to have that person call. Because if they really do have bipolar, you're going to need to be with them for a while. You got to go through some cycles too as a therapist.
Well, there's one more thing there, right? You mentioned when there's good or stable times, if you can call it that way. So I assume, or I'm asking you actually, what is your recommendation? Do you get treated when you're stable, or do you wait to be depressed or manic? Which we said you want.
There's never a bad time for treatment.
Sounds like you're a therapist.
I'm serious. Either way, whenever a person comes in and says, I don't like who I am, that's a perfect time to start.
So other words, you would recommend maintenance.
Yes. Oh, maintenance for sure. And what's interesting about bipolar 2 and 3, you don't have to be on medication if you know your triggers. If you know what causes some of the stress or what makes you stay awake, or you avoid, if you have good sleep hygiene, if you take vitamins, if you exercise, if you have a good support system, you don't have to have medication if you have all those other things. So we have to promote a healthy mind. It's a beautiful mind. It can do 1,000 things. We can't limit it.
Absolutely. I would definitely have to agree with that. And we are just about 45 minutes past the hour, and you are watching In Session on WJZZ Cool TV, the coolest station in the world. And I am Dr. T.
I'm Dr. Fishta.
And we have with us Michelle Clear, and we are dismantling the myths of bipolar disorder. So this is not a disorder that's going to debilitate anyone.
It has the ability to, though, let's be honest. It absolutely has the ability to destroy people. Unfortunately, the mind, we don't know what's going on up there. And I think it's unfair to think that there are so many people on disability that don't deserve it. I think it's one of those very careful things that we have to talk about, simply because with the variety of bipolar that is on this planet, and there is a lot of variety, you can have bipolar disorder and schizophrenia at the same time.
Absolutely.
And that is going to be a psychosis that's not going to be manageable, and it's not going to be, that's probably the homeless. I mean, let's talk about it. Let's talk about the people that we see on the streets that don't have a home, that have lost relationships, that don't have careers or jobs or places to go. They broke from society because they didn't fit in with society. And we need to really look at that, and it's unfortunate to say, oh, that's a bipolar person. We don't know. You don't know.
Yeah, and you brought in schizophrenia, and as you guys know, my study, my dissertation has to do with schizophrenia, and you have the schizoaffective. So basically, you have when a person is out of touch with reality. Now you also have mood swings intertwined there, which makes it very, very difficult to function. Right. We're talking.
You don't care. You're not going to brush your teeth. You're not going to take a shower. You're not going to go to work.
Once you go at that level, we're talking about studies telling us that a person will live 25 years less than a person who doesn't have a mental disorder. Once you have schizophrenia, bipolar, and such a severe mental illness, and sure, homeless sometimes they're facing and so forth because of the person's inability to function in a society that's been constructed in certain ways, right?
Right.
Now, very quick also, Michelle, before I know we're ending soon, but teenagers, right? We know that the second cause of death for teenagers is suicide, right?
That's correct.
The first cause of death is car accidents, and that is those heat of passion decisions being on the wheel.
The recklessness, the reckless behavior, the impulse control.
That's correct, and I'm hinting at the hypomania and mania there that the teenager can go through now.
The problem is, we don't really, man, that's a tough one. To diagnose a teenager with bipolar disorder, you got to really look at their patterns of behavior, because you can't just say every teenager is bipolar. That they all have impulse. They're all not thinking with their full brain, right?
And their hormones are not regulated as well, so we have to look at that. But you were saying, what should we be looking for?
We should definitely be looking for impulse control. We should be looking at self-esteem issues. We should be looking at mood. We should be looking at how do they relate to authority. How do they care? self-care becomes, unfortunately with real bipolar 1, self-care kind of goes to the back waist. If you got a kid that doesn't want to brush their teeth, take a shower, get dressed, when you don't want to function like the rest of society, there's your warning. I mean, it's okay for a kid to go a couple days without a shower. A week, something's going on. You know, I've had clients that are afraid of water. And so there's mental pieces that go with this diagnosis that clients are afraid of, things that you kind of got to figure out what it is that's making them so antisocial and so anti-following the rules.
And that's what I was going to ask. That was my next question. So with individuals with bipolar disorder, do they really engage with family, friends, and social activities?
Yes and no. Again, remember, you're going to have different personalities and different people. Some bipolar kids are the funnest kids you'll ever meet. They're outgoing, they're fun, they're sociable, and then you have...
With the exception of those extreme ones.
Right, except if they're in a bad spot. But for the most part, that's going to be a fun kid. You're going to, they're outgoing, they're fun. If they're in a mood, they're going to isolate. They're going to usually hide from their friends. They're not going to go out. They're not going to do things with their friends. They're going to start to isolate. And that's another thing, an area that we can look at with teenagers is when they start to isolate from friends. That becomes a problem, and when they start to self-talk about how negative they feel, that's another kind of worry that I start to be concerned about. You got to pay attention to their friends. I think it's really important that we know who they're hanging out with.
Because substances, right?
Oh, yeah.
We talk about impulsive decision-making process. Now, some of that is natural, right? You're a
Right.
teenager, and you got the hormonal changes.
Sure. And they just don't know, and they want to try everything anyway. They think
That's
they're
right.
invincible, so
And
I want to be like that again.
we know certain substances can really
Oh,
throw
for
a
sure.
teenager off
Yes.
the track and get them into real dangerous behaviors. And now, is this use of substance, could that be a byproduct of bipolar disorder?
Yes. Yeah, I
Okay.
think so. And you'll find a lot of co-occurring. And actually what I find in families that they don't even know they have bipolar, they're going to have a ton of alcoholism.
Okay, so other words
Yeah.
masking these
Masking
So
the
they're going to
signs.
self-medicate.
Yep.
That's what it sounds like,
Yep.
self-medicate.
Marijuana, alcohol.
Now, there have been recent studies that actually state that that marijuana is actually beneficial to individuals with bipolar disorder. What are your thoughts on that?
I actually believe that because it has that calming effect. I don't want to be an advocate for it, but I'm not an advocate against it either. I really think that we have freedom of choice. Every person has individual decision making, and what's so interesting about bipolar is because of that chemistry in your brain, we're not sure which one of that. I mean, we know alcoholism is always going to lead down a path of danger. I'm sorry, I'm never going to advocate for alcoholism. Marijuana, I don't have enough research yet on that one, and I kind of believe that it is a self-medicator, so I don't know.
And here, I'm closely paying attention to you, Michelle, and I get the feeling you're saying this because possibly you may have clients who use marijuana.
I have a lot of clients that yeah, unfortunately I do.
But with marijuana, I mean, and I'm the research behind it.
Right.
You have to be cautious because you want to make sure that you're using the right strand. Because if you're using a stevia,
Again, you're going to give yourself a stimulant. You're going to go right back to mania.
Right, so you
have
want to go with the indica if you have bipolar disorder and you're trying to manage mood. So you
Right.
have to be very specific and not necessarily get it from off the street because you don't
Right.
know what you're getting.
Right.
But if you're going to have medical treatment, you've seen a doctor.
There's
you have
a lot of medical marijuana clients that I have, and I'm finding more anxiety people are on marijuana. So
Yeah.
they're using it.
Yeah, and it's not a bad thing. It's been proven beneficial. We have quite a few drugs that were designed for mental health treatment, and then they've been used for other medical reasons as well, and for pleasure. So,
Well, and there's a lot of studies in treating mood swings and depression with psychedelics and so
Right.
forth that were actually back in the 60s.
yeah,
They were
not
very
acid
valuable.
though. The acid that I don't think that was a good one. That was not a good one there, but maybe the mushrooms, right?
And
Try not to think about any of
it's
it.
very interesting to see what happens with the new pharmaceutical treatments that they have trials on. So we'll
Yes,
see what happens.
yes. So we have 2 minutes
Okay.
before we depart. What do you want to let everyone know? What do you want to say?
My greatest thing is to leave everyone with the thought that bipolar disorder is a beautiful thing. And the reason why I feel that way is because the brain is special. And if you have a disorder, whether it's bipolar or anxiety or depression or whatever it is allowing you to think in a way that is self-preservation. And you have to look at your thinking is what we think we create. So I don't want people to think that, oh, I have this disorder, I'm a horrible person. That's the last thing I want people to think. I want them to celebrate it. I always tell my son, you get the whole box of crayons. And if I could leave anybody with that, that would be that hope that color, use what you've got. Make it work for you. Find a passion. Most of the most creative people on this planet have bipolar because they've used their mania for good. They've used their creativity. They've used it.
And I believe that's where counseling and therapy comes in handy because
Right.
it helps you identify strengths and weaknesses, and then so that way you can
Right.
utilize them actually.
Right.
your
And to
advantage.
give you those strategies.
Right.
And to give you those strategies.
Right.
So I want to thank our guests for coming in
Well, thank you
today.
very much for having me, guys. It was
Thank
fun.
you so much. Good
Yeah.
to have you, Michelle.
Yes. And you have been watching In Session on WJZZ, Cool TV, the coolest radio station in the world. And we will be back next week as we will be talking about trauma. And we will have Cheryl Wilson-Smith with us in next week. And I hope you all have a wonderful and prosperous remaining of the week. And if you want to advertise on this show or any of our wonderful shows here, please give us a call at 313-355-6018. And it's been a pleasure, and we'll see you all next week.
Thank you.
Thank you.